Care of patients with emergent conditions, trauma, and shock. Chapter 45. Accidents in the home and community rank sixth as the leading cause of death for all age groups. Individuals younger than 5 years and older than 65 years are the major victims of fatal mishaps that occur within the home. Thousands of individuals are killed in the United States each year in motor vehicle accidents, and an additional 2 million are injured. Water safety rules include selecting safe swimming areas, ensuring supervision of children and adults who are not strong swimmers, diving where the water is sufficiently deep and free of rocks or obstacles, never swimming alone, and never swimming distances beyond one's ability. Every day, about 10 people die from unintentional drowning. All states and the District of Columbia have adopted some form of the Good Samaritan law that protect medical personnel and non-medical civilians from liability when rendering emergency medical care for victims of an accidental injury. These laws will guard against liability for care as long as the medically trained individuals act in good faith to the best of their ability and stay within their practice standards. Half of health professionals have been verbally assaulted and 1/4 have been physically assaulted. Patient factors that are associated with an increased incidence of attacks on healthcare individuals will include paranoid schizophrenia, personality disorders, dementia, substance abuse, and a history of abuse or violence. Physical force should only be used when there is a threat of physical danger and verbal intervention is ineffective. OSHA requires employers to provide a workplace that is free from recognized hazards that cause or likely to cause death or serious physical harm. Patient violence toward healthcare individuals falls within this category. Workplaces are required to have a violence prevention program. Nurses are mandated reporters in most states and need to recognize signs and symptoms of physical and psychological abuse. Physical signs and symptoms may include bruises, swelling, lacerations, fractures, hematomas, blackened eyes, abdominal injury, burns, and open wounds that do not match the description of how they occurred. Bruises or fractures in various stages of healing and signs of old laceration and wounds in the presence of new ones indicate a need for a thorough assessment of abuse. Often the victim may explain all injuries as the result of a logical accident rather than disclose the battering that has occurred by an intimate partner. Emergency nurses need excellent assessment and clinical decision-making skills and the ability to prioritize care under stressful situations. Emergency room nurses routinely follow protocols to initiate diagnostic testing or to start therapy like oxygen administration or a peripheral IV access. Clinical decisions, prioritization, and the use of protocols are based on events or incidents that preceded the emergency visit, the mechanism of injury, and the index of suspicion. The process of setting priorities of treatment is known as triage. One of the most common methods for triage of patients uses A, B, C, D, E for the sequence of assessment. A is airway, B, breathing, C, circulation, D, assessment of neurologic disability, E, exposure. All areas of the body should be exposed so that injuries are not missed underneath clothing. The most common cause of airway obstruction in an unconscious individual is the tongue. Severe bleeding can rapidly lead to irreversible hypovolemic shock. Arterial blood is bright red and gushes in spurts at regular intervals. Blood from a severed or punctured vein leaks slowly and steadily and is dark red. Neck or spine injury should be suspected in any situation where the individual has sustained multiple injuries, has fallen, or is unconscious. Penetrating thoracic trauma is less common but is more likely to be fatal than blunt chest trauma. Any of the structures located within the chest may be involved in the injury. There can be contusion of the myocardium, puncture of the lungs, rupture of the aorta, diaphragm rupture, and tracheobronchial injuries, in addition to bone fractures. An open or sucking chest wound is one in which the pneumothorax or hemothorax results from external penetration of the pleural cavity. Symptoms of a pneumothorax or a hemothorax would include labored, shallowed respirations that cause bubbling of blood at the site of the wound, lack of movement on the side of the chest when the person inhales and exhales, and chest pain. Children younger than 5 years old are at risk of accidental poisoning. Children 12 years and older are more commonly have intentional ingestion. Prescription medications of family members are the most common poison emergency in the 5-year and younger age group. The symptoms of poisoning will vary according to the substance that is ingested and the time that has elapsed since it first entered the body. Poisoning should be suspected if the victim becomes ill very suddenly, there is an open poison or drug container nearby, a peculiar odor to the breath, pain or burning sensation in the mouth and or throat, an increase or decrease in the pulse or respiratory rate, nausea, vomiting, disorientation, visual disturbances, loss of consciousness, or a deep and unnatural sleep. Opioid overdoses will produce pinpoint pupils, unconsciousness, and respiratory depression. The treatment for drug ingestion may include activated charcoal to decrease absorption of poison, a gastric tube insertion, irrigation to remove the stomach contents, sorbitol to enhance bowel excretion, and antidotes that are specific to the poison. Symptoms that may indicate inhaled poisons will include excessive coughing, shortness of breath, wheezing, burning sensation of the nose and throat, pale or bluish color to the skin, dizziness, headache, nausea, vomiting, chest pain, or tightness. Non-poisonous snake bites are treated as simple wounds and require only a cleansing of the wound with soap and water and the application of a mild antiseptic. First aid for poisonous snake bites will include washing the wound, lowering the extremity or area and immobilizing it, keeping the victim calm so that the venom does not circulate quickly, and seek medical attention as soon as possible. Water serves as a conductor of electricity, and wet objects can transmit a fatal electrical current to the person trying to rescue the victim of the electrical shock. Water is not used for burns caused by dry lime or phenol. If a corrosive chemical has been ingested, the Poison Control Center should be contacted for instructions. Obstructed airway is the 7th leading cause of accidental death. Adults and children can become choking victims and need immediate intervention to prevent death from asphyxiation. CPR is indicated when the individual shows an absence of response to stimuli, an absence of respiration, and an absence of a carotid pulse. When an individual stops breathing spontaneously and their heart stops beating, clinical death has occurred. Within 4 to 6 minutes, the cells of the brain, which are sensitive to a lack of oxygen, begin to deteriorate. If the oxygen supply is not restored immediately, the patient will suffer from irreversible brain damage and biological death will occur. Shock is a condition that starts at the cellular level and then gradually spreads to produce clinical signs and symptoms. The hallmark sign of shock is a lack of adequate perfusion to the tissues. This results in the lack of oxygen and nutrients. This deficit causes anaerobic metabolism and the production of lactic acid and organ dysfunction. Conditions of low circulating volume, hypovolemic shock, decreased cardiac output or cardiogenic shock, impairment of circulation or obstructive shock, maldistribution of volume, neurogenic, anaphylactic, or septic shock, cause decreased perfusion for the individual. Perfusion requires adequate blood volume. The blood vessels must be intact, without obstruction to flow, and the heart must be working correctly. Clinical signs of shock. For compensated shock, the body can maintain blood pressure and perfusion by increasing the heart rate and vasoconstriction of the peripheral vessels. The only clinical sign that may be seen is an increased heart rate and cool skin. Decompensated shock, the clinical symptoms associated with this second stage of shock reflect the lack of oxygen to essential organs. Signs and symptoms will reflect decreased cardiac output, as in confusion, restlessness, diaphoresis, rapid thready pulse, increased respiratory rate, cold, clammy skin, decreased blood pressure, and a diminishing urinary output to less than 20 milliliters per hour. Decompensated shock can quickly move to the third stage, which is irreversible shock. There, recovery is impossible. Hypovolemic shock is the most common form of shock. A blood loss of even 500 milliliters in a fragile adult can cause hypovolemic shock. In all instances of hypovolemic shock, volume replacement is essential. Oxygen should always be administered to patients in shock or suspected of shock. An MI is the primary cause of coronary cardiogenic shock because of the direct damage of the heart muscle from the heart attack. Myocardial ischemia resulting from acute coronary syndrome is the primary cause of cardiogenic shock. Tissue perfusion can be impaired when there is a mechanical obstruction to the blood flow. Pericardial tamponade, tension pneumothorax, constructive pericarditis. There is a physical obstruction that prevents adequate filling or emptying of the heart. An aortic dissection or massive pulmonary embolus. Here there is a problem in the blood vessel that prevents forward flow of blood. Classic anaphylaxis is a massive immune response that is set up by a previous exposure to an antigen. The antigen-antibody reaction releases vasoactive substances that cause massive vasodilation, increased capillary permeability. The combination of factors causes hypotension, bronchoconstriction, and angioedema of the laryngeal tissue, skin rash and generalized flushing, headache or lightheadedness. Neurogenic shock is the rarest form of shock, but it has a triad of symptoms: hypotension, bradycardia, and hypothermia. Spinal injury or anesthesia can cause a blockage in the sympathetic outflow from the vasomotor center of the brainstem. SIRS is now considered a dysregulated inflammation syndrome and not used in the sepsis definition. Nursing management includes monitoring signs and symptoms and progression to sepsis and shock, and prompt notification of the physician. SIRS is the first part of a continuum that can lead to sepsis, then severe sepsis, and ultimately multisystem organ dysfunction syndrome or MODS. This is defined as 2 or more organs that show signs of dysfunction. Classical progression starts with SIRS symptoms, moving into asepsis, severe asepsis, and MODS, complicated by disseminated intravascular coagulation. In this sequence of events, if it continues, the mortality rate will range from 28 to 80%. The wide range is affected by multiple variables such as age, pre-existing illnesses, and access to treatment. Early recognition and effective treatment of this cascading of events is the most significant factors to help reduce the mortality risk. When a patient is at risk for sepsis, the nurse should monitor for slight changes in conditions. Warm, dry, flushed skin, full bounding pulse, normal to high blood pressure, and elevated urine output. The temperature may be normal or slightly elevated. Some patients do experience a high temperature with sepsis. However, older adults may experience hypothermia when they are septic. For the assessment of shock, it is an ongoing evaluation and assessment of the patient, their level of consciousness, vital signs, skin temperature, as well as urine output. A 50-year-old Korean man is admitted for acute alcohol intoxication. Anticipating combat behaviors, the nurse uses which communication skill to help obtain clinical information? Establishing eye contact, using the person's name frequently, expressing genuine concern about the situation, using a loud commanding voice, involving essential family members. The correct answer, 1, 2, 3, and 5.